Why do women lose their sexual desire? A variety of physical, psychological, hormonal, and relationship factors can cause women to lose their sexual desire, also known as low libido. It is a very common experience and not necessarily a sign that anything is wrong. Physical causes: hormonal fluctuations. Changes in hormone levels can significantly impact a woman's sex drive. Menopause. Falling estrogen levels can reduce sex drive and cause vaginal dryness, which can make intercourse uncomfortable or painful. Pregnancy and breastfeeding, hormone shifts, fatigue, changes in body image, and the demands of caring for a newborn can all put a damper on sexual desire. Contraception. Some hormonal contraceptives, including the pill, patch, and implant, can lower a woman's sex drive. Medical conditions and treatments. Many illnesses and the side effects of their treatments can affect libido. Chronic illness, conditions like cancer, diabetes, heart disease, high blood pressure, and neurological diseases can impact sexual function. Medications. Common drugs such as antidepressants, especially SSRIs, and those for high blood pressure can reduce sex drive. Fatigue. Exhaustion from work, caring for others, or illness can decrease libido. Chronic fatigue can also be a symptom of underlying medical issues. Surgery. Operations involving the breasts or genitals can negatively affect body image and sexual function. Sexual issues. When sex is painful or unfulfilling, it can understandably reduce a woman's desire for it. Pain during sex, dyspareunia. Vaginal dryness. Infections such as urinary tract or yeast infections that cause discomfort. Difficulty achieving orgasm. Lifestyle factors. Everyday habits and stressors have a significant impact on sexual interest. Alcohol and drug use. While a little alcohol may lower inhibitions, too much can harm sex drive. Illegal drugs and smoking can also play a role. Physical activity. Both an overly sedentary lifestyle and excessive exercise can impact libido. Psychological and emotional factors. Stress, anxiety, and depression, mental health conditions, and general life stressors can be major inhibitors of sexual desire. Anxiety can trigger stress hormones that lower sex drive. Work, financial, or family-related stress can interfere with arousal. Depression is often accompanied by a loss of interest or pleasure in activities previously enjoyed, including sex. Self-image. Poor body image and low self-esteem can cause anxiety during intimacy and dampen desire. Past trauma. A history of emotional, physical, or sexual abuse can lead to psychological barriers to intimacy and sex. Relationship issues. Lack of intimacy. Emotional closeness and sexual intimacy are often intertwined. A lack of emotional connection can decrease desire. Poor communication. Couples who cannot openly discuss their sexual needs and desires may experience lower satisfaction. Unresolved conflict. Ongoing arguments and underlying relationship tensions can reduce sexual interest. Unequal burden. If one partner bears a disproportionate amount of the household's labor or childcare, it can lead to exhaustion and resentment, which harms libido. Partner's sexual problems. Concerns about a partner's sexual function or performance can also contribute to a woman's decreased desire. When to see a doctor? While fluctuations in sex drive are normal, consider seeing a healthcare provider if your low libido causes you or your partner distress, or if you suspect it's related to an underlying medical condition. A doctor can help determine the cause and recommend treatment options.